Information is key. Good evening, everyone. Thank you so very much for making it to the live digital town hall meeting. The topic of discussion, no surprise there, the coronavirus or COVID-19. I am Terri Karelle Reid. I am pleased to be your moderator. And this town hall meeting is powered by the Ministry of Health and Wellness. Please allow me to acknowledge the persons in my midst, persons who I do not envy at all. To the Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, thank you so very much for being here. To Dr. Simone Spence, Director, Health Promotion and Protection Branch, thank you so very much for being here. Dr. Bernadette Theodore-Gandi, she's the PAHO/WHO representative to Jamaica. Thank you very much for being here. I'd also like to acknowledge the presence of Antoinette Aiken, who is our official sign language interpreter. We just want to remind everyone that when it comes to disaster preparedness as well as emergency, it is extremely important for us to always include members of communities that are considered to be vulnerable. So I just want to say thank you so very much to Antoinette Aiken and to members of the deaf community who might be tuning in, might be joining us. We say good evening and welcome. All right, so I know that we just had we had an emergency press conference a while ago at the office of the Prime Minister. And for those of you who want to be a part of the conversation, please go ahead and use the hashtag JACOVID19. There's also a platform that we're using that you can submit your questions, slido.com, SLIDO.com. Please submit your questions using the hashtag JACOVID19. Please ensure that your questions are brief, that they are related to the coronavirus, and no question is stupid. If it's valid to you, if it matters to you, it matters to us. All right, so I'm going to leave you with the floor. We do understand that a second case has been confirmed, which is why we had that emergency press conference. So I will leave the floor to you.
Thank you very much, and good evening to all. Good evening, viewers out there. First of all, let me apologize because this town hall meeting was scheduled for much earlier, but because of the emergency cabinet meeting and the subsequent press conference, we had to delay until this time. So apologies to those who may have been waiting. The Ministry of Health and Wellness, and by extension, the government of Jamaica and the people of Jamaica has been confronting this issue of the coronavirus since January of this year. In that very short space of time, just 2.5 months or so, the virus, which started, as you know, in China, has spread to over 120 countries, has affected over 100,000 citizens of the world, and has claimed, I think, close to 4,000 lives or thereabout, 4,600 lives. The virus is therefore extremely aggressive in terms of country-to-country spread, and within countries, it is also very aggressive. It has created a lot of panic, a lot of fear, and it's the case because of the nature of the virus. It's called the novel coronavirus, novel COVID-19, because novel means it's new, and the world has not developed an antidote or resistance to dealing with it, and therefore it affects us, and for the vulnerable, it affects them more so. My doctors to my left will give greater details on that, but just to close by saying the ministry and the government is doing all that is necessary to firstly inform the population about this virus and what it is and what it means to us. Secondly, to reduce as much as possible to prevent the virus from coming in. We now have 2 cases. Having had these 2 imported cases, meaning someone picked it up in another country, in this case, both cases came from the UK, we have to contain, so those persons are being treated, and we are also tracing those persons that they have been in contact with. And the third component is how do we develop the health infrastructure. And that infrastructure is going to be more needed if we have internal spread called community spread. The Ministry of Health is well prepared in that we have been working on this for some time because we anticipated this. And as the program goes on, we'll be willing to discuss any specifics around our healthcare infrastructure, our healthcare workers, and the program that we have engaged so far with stakeholders to keep them informed on what's happening.
Thank you so very much. And for those of you who might not already be aware, the coronavirus, according to the WHO, is now considered or categorized as a pandemic based on the amount of countries, based on the type of transmission, the rate of transmission in the very short space of time. And although they did categorize it as pandemic, they're also saying it is not a word to be used to induce fear or panic, just basically letting us know how this virus is affecting the world. And as the minister said earlier, there have been 126,000 cases at this moment, 126,000 cases in 122 countries, 4,616 deaths, but we've also seen 67,000 recoveries, which is something that a lot of us are not speaking about, and hopefully we can get into that conversation when we have the question and the answer. So the minister gave us an overview in terms of the state that we're in now and the steps that we are taking and that we will be taking. So I'm going to move to Dr. Simone Spence. And the question I have, or I'm going to give you the floor, is, well, everyone is saying COVID-19, and every corner and every WhatsApp group, everybody's speaking about the coronavirus. And yet, see, when I've asked a number of persons, well, what is it? What does it do? How does it affect us? No one seems to quite know. So I'm going to allow you to kindly just inform and educate our viewers in terms of what it is, what it does, and what are the sites that it is more likely to target.
Okay, so thank you so very much, and thanking the viewers for allowing us this opportunity to continue to inform and educate them about COVID-19. So first of all, coronaviruses have been around for quite some time. There are a large family of viruses that are found in both animals and humans. But COVID-19 specifically is a new type of coronavirus, which was first discovered or described in Wuhan, China in December 2019.
Right.
And so therefore, we don't know, we know some things, but we don't know everything about it currently. So coronaviruses in general affect the respiratory system, the respiratory tract. So this is why it normally presents in terms of most cases with mild disease. So common symptoms are a cough, sneezing, so common flu-like cold symptoms, right? But for some persons, they may develop severe cases or severe illness along with complications. And so that may be severe acute respiratory syndrome where the lungs are particularly affected. They may develop pneumonia, and especially in persons who are most at risk, which would be our elderly persons and other persons who have what we call comorbid conditions. That means other underlying diseases such as high blood pressure, diabetes, heart disease, cardiovascular disease, for example, may be impacted because their immune system is not as strong as somebody who has no other condition of concern.
Right.
And so it impacts the respiratory tract. So persons also with chronic lung diseases, so for example, our asthmatics may be of concern, especially in older persons who have what we call COPD, chronic obstructive airway disease, and those persons are more at risk of developing more severe disease. Okay. But this is usually the smaller proportion of the population. The other concern is the fact that because it's a new virus, the population really does not have an immunity to this virus because it's the first time the population is being exposed to it. And so therefore, we do expect that a number of persons will come down with it. Some will not be expressing any symptoms at all. Some persons will have very mild symptoms, and then a very small proportion of the population will actually be sick enough that they have to now present at the hospital and be admitted, and then possibly develop severe complications as a result.
So would you rightfully say that at this point in time, no one should be trying to diagnose, oh, it's just a common cold, oh, it's just a flu, this is going to go away? Do you think at this particular point in time, regardless of whether it is just a sniffle or something that we believe might be the flu, they need to come in?
Well, I would say that in terms of this current situation that we're in Jamaica, the fact of the matter is this is also flu season as well. So common things are common. So if you're having flu-like symptoms, it is more likely to be influenza or the flu or other causes of acute respiratory illness than COVID-19, because even though we have had our first 2 cases confirmed, they're imported cases, right? And so we haven't established local transmission. So it's more likely that if somebody is expressing symptoms now in the wider population, it is more likely to be an acute respiratory tract infection from common cold viruses or the flu, not to panic. But what it does mean is that if you know, for example, you have had a travel history to a country that has local transmission, that has a disease there, you may be of concern, and so we ask that you contact your local health department, the Ministry of Health and Wellness, so that we can guide what happens. When persons start developing severe symptoms, so for example, we say common cold, you have the little sniffles, you cough, but once you start developing shortness of breath, can't finish a sentence, then regardless of the cause, then that is of concern, and so therefore you would need to contact your healthcare provider, whether it is your private practitioner, the local health department, the Ministry of Health and Wellness, so we can guide you as to what is the next step. One of the things we want to ensure is that we minimize the risk of exposure to others. So we don't want persons necessarily, going into, for example, taking public transport and heading to the hospital and clogging up the health centers per se. But once you make contact, we'll be able to ascertain, is this something that we need to be concerned about? And therefore make the necessary arrangements for you to come into a health facility while minimizing the risk to others around you.
Right. Thank you so very much. And again, if you're just joining the conversation and you're just tuning in from wherever, whether it is locally or internationally, we encourage you, we invite you to continue using the hashtag JACOVID19. So I had the opportunity of tuning into the WHO press briefing this morning. It went live on LinkedIn, and I saw them speaking about a blended strategy, that it can't just be containment, but it has to be containment as well as mitigation in regards to where the healthcare and the public sector is. So I'm going to ask, for persons who may not necessarily be familiar with PAHO or WHO, what is the role of those 2 entities here, not just here, but globally where the coronavirus is concerned? Dr. Gandhi.
Thank you very much. Good evening, everyone. The Pan American Health Organization is the regional office of the World Health Organization. And therefore, as PAHO, we serve the region of the Americas. The WHO, the World Health Organization, is the global entity for coordinating health for public health. And the role of the World Health Organization is basically to coordinate the country perspective, the regional perspective, and the global perspective in terms of coordinating the response to the disease. So some of the things that we do is, first of all, collate the data and analyze the data. We keep people informed of what is going on, and in this way we have been able, through the reporting of the international health regulations, to pick up the outbreak in China in January, when China reported on this novel coronavirus, and disseminate that information to countries and monitor how the countries and how the data is increasing. So in that way, we are being able to monitor the progress of the disease throughout the countries. Through that, we're also able to monitor what works and what does not work, and what countries are doing that's effective, and some things which may not be as effective. So therefore, we also provide advice to countries based on that evidence, in terms of advising them some of the innovations that countries are taking, etc. We also work with a lot of collaborators in various universities and in various countries to look at the evidence, to look at what is the clinical management, what is the new evidence in clinical management, how best to manage the disease. Of course, China now has a lot of experience, and they're very willing to share that experience. Italy is now getting a lot of experience. So the role of WHO is to coordinate and network, to understand the clinical management, to see what works and how to advise other countries who are now experiencing increasing numbers of cases of what they can do.
Right, fantastic.
We're also looking, as well as advising countries, we have an expert team looking at infection prevention and control, because of course we know that one of the critical areas will be healthcare providers, and what we should do to prevent people from being infected. So that's another one of the areas that we do, and of course in research and development. So for example, working and collaborating with a number of researchers and countries in terms of research and development, introduction of the vaccines, and again, identifying what drugs could be used. But in terms of the pandemic response, what we are saying is that we still believe that the disease can be contained in countries, and what is required is a holistic approach, a whole of government approach, a whole of people approach, which means that every single body, the governments, the people of the country must be directly involved, must take responsibility, and must have the information. So that is absolutely critical. And we also still believe that even at this point, and from the evidence we have seen from China, from Italy, that if we can work with aggressive contact tracing, we still have the opportunity to contain the disease. And it has worked in China, it is working in Italy, it has worked in Korea. But it has to be very aggressive contact tracing, which means that the population and the public have to understand that and be willing to cooperate and work with us, because the cost of containment is much less. Once it gets to local transmission, of course, then we move on to mitigation, and we do containment and mitigation at the same time, which then involves the social distancing we should do right now, but involves all the other measures as well.
All right, thank you. The Director General from the WHO was saying that it is important to test, to trace, and to isolate. And for those of you joining us or watching us, really what we're trying to do is to prevent further spread, because usually you move into clusters, which means that a lot more persons are in contact with the virus, and then if it becomes too much or the rate of transmission increases, then we are now looking at community transmission. Thank you so very much for the overview. We know that we had our emergency press briefing, but we really want to make this a dialogue. We do understand that we have persons who are concerned. You have your questions, and certainly this is the forum that has been provided to you by the Ministry of Health and Wellness to allow you to air those questions and concerns, and we will try to answer them as best as possible. As those questions come in, I do have a question. We saw that the 2 confirmed cases have been from the UK. They've come in from the UK. We've seen a list of countries that are on our travel ban. I think Germany, Spain, and France were just added. So persons might be saying, well, why is UK not on the banned list? Is there a policy? Is there a review or process that you guys have to go through? So
we monitor the risks with respective jurisdictions on a daily basis, and there are several variables that go into deciding what actually determines where we impose restrictions.
Okay.
In the initial stages, it would have been where the virus existed. So we started with China. Then it morphed into an additional number of countries. But now the virus is in over 115 or 20 countries. A bigger criteria now beyond that is the rate of spread within a particular country. And so when we added recently, as close as a few days ago, 3 countries in Europe, that would be Spain, France, and Germany, it was because in our estimation, based on the rate of spread, very aggressive rate of spread, we felt that we could slow the introduction. Because remember I said, first challenge for us is to slow the introduction of the virus in the country, because we figure we're an open society, that over time, the vector, which is us, would take it in one way or the other. So we added those countries. So that would be an issue. There are other variables that go into deciding, the relationship in terms of other critical activities with a country like trade. Truth is, we're food dependent. We need supplies. The US is one of our key markets. And practically speaking, you have to mitigate and manage the risk of restricting travel while also maintaining the relationship for other things that you need. The UK does concern us because, as you said, 2 of the 2 cases we have are imported from the UK, and the rate of spread in the UK concerns us too. We've been monitoring that. So it is something we're watching, but the decisions are made as we monitor on a daily basis based on how we perceive the risks.
And then that decision will be made depending on the factors that
Depending
you're
on the
looking at.
factors, exactly.
Okay, a question here that has actually been upvoted on Slido with 127 likes. It says, in the event that schools are closed, even though our Prime Minister stated that that is not the case, he has not called for a closure of schools. In the event that schools are closed, will provisions be made to facilitate learners online where possible? Maybe via the e-learning Jamaica platform? That's a question that has been posed.
The Prime Minister was very clear on that a short while ago. He indicated that based on a part of the plan that we have for containment would be to suspend public gatherings of one form or another. And he made some specific announcements there. As it relates to schools, he did indicate that this is going to have to be one of the options exercised, but there was still some additional work to be done in terms of notifying parents, finding alternatives. But in that too would be for the Ministry of Education to look at other ways of teaching. And the online arrangement would certainly be one such, so that kids, if they have to stay out for a while, would still have
the learning.
Something happening, yes.
Okay, fantastic. Dr. Spence, I'm going to head across to you because you did mention asthmatics, and that was a question that I was going to pose because I am an asthmatic and almost everyone in my family is also asthmatic. But we keep on speaking about the elderly being the ones that are mostly the vulnerable. What about those of us who are not very old but not very young, probably in your late 30s, but asthmatic? For those asthmatics out there who have respiratory weakness or compromise, what about us?
Well, for anybody who has some sort of compromise, of course, there is always concern, but you manage accordingly. And so it depends on the individual because there are multiple factors. The way I respond to a virus is not only going to be dependent on the fact that I have comorbid conditions, but other factors as well. How well controlled am I at that point in time? How healthy am I? Am I already sick or having other issues of concern? And so what it is just making sure that we, as individuals who have chronic conditions, are prepared in terms of making sure that we're taking our medication as is prescribed, managing our comorbidities, our conditions that we have, and ensure that we are in the best possible healthy state, that if it is that we come into contact with the virus, our body has the requisite, I would say, power to fight off the challenge that is presented.
Do you suggest that persons, I see on Twitter and social media platforms, persons saying, boost your immunity, take your vitamins and your supplements and all sorts of things. Is this true? Because we're also trying to bust whatever myths that might be out there. So,
right.
How does that work?
In terms of, I know persons are talking about, for example, taking your honey and your lime and these, remedies. Remember, this is a new virus. We don't know exactly how, what, why, when, where things will happen or challenge. But if we have strong immunity, and for some of us, vitamins are an important part of that because for some reason or another, we may not be taking in the requisite minerals and vitamins through our normal diet. Then, of course, you are supplementing. But at the same time, we must also understand that we need to keep informed and keep abreast of what is happening and, follow those advisories and directions as they come. Absolutely.
Going back to Slido, we have a question from Theo. Why not have a mandatory 12-day quarantine? And I believe it's Israel. I'm not too certain. I don't know, Dr. Gandhi, if you can tell me. But there is a country that regardless of where you're coming in, you are in a 14-day quarantine. I believe it's Israel. So Theo is asking, why not have a mandatory 12-day quarantine of all passengers entering the island on international flights from countries with confirmed cases of COVID-19? Why not a mandatory 12-day quarantine?
Well, I'm sure Dr. Gandhi would have her take on it. Our take on it in terms of it really is an issue of the risks and an assessment of the risk. The countries where we have instituted restrictions on travel, while we would have restricted those nationals or persons visiting that country within 14 days to come into the country, For Jamaicans who are in those countries coming in within that 14-day period, they have a mandatory quarantine arrangement. So we actually have persons and have had persons in quarantine. As it relates to everyone in a country that has a coronavirus, that would mean 120 countries. The practicality of it would be difficult, but the concept of quarantine and self-quarantine is very important. We're now moving to a stage where we are actually encouraging persons to self-quarantine.
And for those who may not know what that
Self-quarantine
means, what is
meaning
that?
staying at home and maintaining a separation between yourself and others within that space for a period of time. And 14 days is the period of time where the virus would now become sufficiently obvious. So we would recommend that from persons coming in from those countries, whether or not we have a restriction on those countries. And that's going to be a part of the narrative going forward as part of the containment.
Okay. The minister here mentioned self-quarantine. Is it practical? Is it realistic? Can we trust persons to come in and self-quarantine and self-regulate themselves, monitor themselves, try to reduce and mitigate contact with other persons? Is it something that we've seen in other countries where self-quarantining is doable?
Yes, self-quarantine is doable, and this is, I think, why we need so much to get the public support and to give out the information. Because I think once people understand why they need to self-quarantine, the fact that they're protecting themselves, their families, and other people who are probably more vulnerable, I think they will understand why we need to do this. And to be honest, it's a very small ask for the benefits that will be gained.
I think when we speak about quarantine, and I'm going to jump in on behalf of some persons who, forgive them, but when they hear quarantine, they think of movies like Outbreak and Contagion. And they think of persons in hazmats, pricking and probing and stabbing, and it can be very scary. So if you could, either of you, tell us what that process is. We heard about the gentleman, Kemar Bailey, who was a runaway, out of the quarantine. And so our idea is, how do we explain to persons what this quarantine process is like, that it's not scary, that can probably help them to calm their nerves where that's concerned?
All right, so we use the words quarantine and isolation, sometimes interchangeably, but there is a slight difference. When we say we quarantine individuals, whether in public facilities or at home, what we're saying is that these individuals, though they have a risk, it's not a high risk, and they're not symptomatic, meaning they're not having a cough, cold, flu-like symptoms, they're not having fever. But they still need to be monitored for the 14-day period. So persons who are then put in facility quarantine, what we're saying is they're coming from a high risk, especially from those places where we already have a travel restriction on them. And then, for example, we do a home assessment to see whether or not, based on the home circumstances, is it suitable to be able to maintain the distancing, ensure that they're being monitored on a frequent basis, and ensure that they can maintain that process. If they can't, then we err on the side of caution and say, let's have you in facility for this period where we can closely monitor what is happening because of your high-risk profile.
So nobody's tied down, nobody's held down, nobody is tied down. Okay.
Persons are in their rooms, and we try to make them as comfortable as possible. But the reality is the reality. I mean, you're not going to have the home comforts where you are allowed to walk around any and everywhere you want to go, and you are not allowed to, congregate and be having the conversations with everybody else in the facility, etc. And so it is a matter of restriction, but we have to understand there is some level of personal responsibility as well, and we're looking at the greater public good and trying to mitigate spread. For persons who are in isolation, it means that they are symptomatic and there is a concern. So they either have a cough, sneezing, fever, and so therefore we suspect that it is a possibility. And so they are placed in isolation in one of our isolation facilities at one of our hospitals. And this is where samples are then taken to be sent to the laboratory. So when we say we're sticking, prodding, and poking, I don't want us to be fearful of, but we need to take samples in order to test, to find out whether or not this individual actually does have the condition that we are suspecting.
Okay, a question that has come in is, it in regards to the capacity of our healthcare system. A lot of persons will tell you, hey, even without, in the absence of the coronavirus, there's issues with sometimes bed capacities with, healthcare workers, space, things like that. With something like the coronavirus that we have seen just completely infect, countries and persons at an astronomical rate. The question is, what is our capacity? Should there be more clusters, or should there be clusters or community transmission?
So what we did, we modeled. We did some modeling. And part of public health is epidemiology, which is to look at the data, to look at trends based on historical perspectives and so on. And we assumed that they made some assumptions around the virus if we had community spread in terms of how many persons would be affected, and therefore by extension how many would require hospital care. So we have that modeling, and that's based substantially on the 2009 H1N1.
Okay.
So we are based on that experience, and also have observed how other countries have been dealing with this. And there's no doubt that if we begin to have community spread true to that model, it is going to put a strain on our public health infrastructure. As you know, and all of Jamaica knows, we're not over-endowed as it relates to public health infrastructure. There's a significant underinvestment. And so we have started a program to upgrade. It's going to require some prioritization. Every hospital, for example, has been mandated to identify a ward that would be committed to the coronavirus treatment. We have already gotten Cabinet's approval for an additional budget, almost $2 billion, Jamaican dollars. We have placed an order for additional supplies, not just medicines, but beds, ventilators, which we anticipate will come in relatively short order. And there's going to have to be a rearranging of our infrastructure to accommodate this particular virus. And for the worst affected, and we also have modeled that and assumed how many will be the worst affected, then those persons are persons with pneumonia, serious.
Right.
And we would then have to put those persons under ICU condition, so intensive care or high dependency, which is what the ventilators and so on be used for. So I would say that we are in the process of getting ready because we have to acquire new items, but we are very sensitive to the reality that we are likely to face. But we want to minimize that, which is why the public education, public responsibility, transparency, so people know what's happening and what they need to do is very, very important, and that's why we've taken that position.
What about the training? I heard you mention it in the brief in the press conference earlier, but what about the training? So we understand that there is the rearranging, and there is the infrastructural change, and there's the ward and everything. What about the training for our healthcare workers, the persons who are going to be our first responders and our frontliners?
So training is something that is ongoing. So since it is that WHO would have alerted us, we have been in that preparatory mode.
Great.
So we'd have done several sensitization sessions with our colleagues, both in public and in private sector. We have developed different guidelines for the management of patients, infection prevention and control procedures, etc., which have been circulated as well. Now what we're doing is the different team members from within Ministry of Health head office as well as from the regions now are visiting the facilities themselves and doing more in-depth training. But one of the things I want to reassure Jamaica of is because we've had the experience with H1N1 in 2009, and infection prevention control procedures are things that we practice routinely on a daily basis. Because it's part of what it is that we should be doing and are doing in terms of managing patients, because at any point in time, patients may come in with a contagious or communicable disease, and therefore it's a part of the process. So it's really about amplifying and enhancing that, increasing our index of suspicion and being vigilant to ensure that our team members are aware of their different roles and responsibilities and are actually implementing and practicing these infection prevention and control procedures.
Thank you, Minister.
If I may, I want to make a point which I think is important. Now, based on the modeling of the numbers to be affected, it may seem high in that we have said over 1 million Jamaicans or more Jamaicans will have upper respiratory ailments.
Right.
But the vast majority of persons who are affected by the coronavirus, we anticipate, as is the case with the historical data that you spoke to about recovery, are going to recover. And indeed, the vast majority will have minor symptoms. So a cold, maybe a headache, orange juice, rest, some basic over-the-counter medication, they're back to normal. That's a very important message, because the sort of global sort of pitch around the coronavirus has the potential to create the impression that once it gets you,
It is a death
it's fatal.
sentence, which is what the Prime Minister said.
And I want it to be very clear that it is not a death sentence. No, we have to be concerned. We have to manage the process. And indeed, very importantly, there are some members of the population, the age cohort, older persons. What the data is suggesting that they are more vulnerable. Older persons with underlying conditions. And we do have a population with a high case of NCDs, non-communicable diseases or lifestyle diseases. So if you're diabetic, hypertensive, any of those major issues, cardiovascular disease of one form or another, then you become more at risk. So the idea about proper nutrition, the idea around, rest, diet, exercise, general health is important as a natural resistance to this or any other virus. For those who are more vulnerable, we're going to have to target the message to give them added protection, because the fact is younger persons tend to recover, older persons tend to have a harder time. And so the message has to be dissected and directed, and we want to reassure the population that most persons who may end up getting the virus will recover and go back to normal.
Thank you for that, which is why I had to research it. I definitely had to research it, simply because when I was looking at the news and everything that the media was broadcasting, really, I thought once you got it, you died, because we did not hear people speaking about the recovery. And I think that is what also helps to induce the fear that we and the anxiety that we see. A question from Slido, upvoted. If an area or community is put under lockdown, will the government provide provisions such as food and water to people until a lockdown is over? Is such a plan in place? Or more importantly, even those communities that have not had water, that literally have come on TV saying no water has run through our pipes, or schools that have challenges with water, how are they managed within this process?
So part of the overall strategic plan that has been developed and presented to the National Disaster Response Team, chaired by the Prime Minister, is how do we function as a whole of society approach? How do we mobilize all the agencies of government? And water, when we presented to that committee, that is the Ministry of Health, water was identified as absolutely critical as part of the infection control measures, the availability of water. I'm telling people to wash their hands if they don't have water to wash it. Now, granted, we have said to use sanitizers where you don't have water and so on. So the National Water Commission, as part of the overall agency of government, that we have said that in terms of trucking, would have to be beefed up for places where you don't have water running in pipes. We also would have to consider where we have sort of lockdown in areas. If it comes to that, then the government would have to have a plan to ensure that persons can survive this kind of restriction. And there, it is a natural part of the program. And if you look at other countries, that is a part of the plan, and we would certainly have to consider that.
So that plan or planning process is
in train.
All right. How long is the travel ban in effect?
On, you mean
The ones that are
countries, the
correct.
restrictions? So the issue is to assess as we go along. There are some projections as to how long this virus will surge and then decline. And it really becomes on the extent to which we see the spread continue and the extent to which countries control the internal spread. We see signs, for example, of China, as Dr. Gandhi said, making progress. we will observe and go along. So it's hard to put a date on it. It's really a function of
Assessment.
the responses, yes.
So we heard about the confirmed case, and all of a sudden shelves, supermarket shelves, retailer shelves, wholesales, empty. There was this knee-jerk hysteria that was going on. Can the MOH work with supermarkets and other retail outlets to limit this kind of hysteria?
So what we've been doing as part of the overall plan is to consult with stakeholder bodies. So we've already met with the PSOJ, which means the chamber and all the different, that's an umbrella body for private sector groups. We are going to be meeting, this evening I met with some of the medical associations. We're going to meet with the churches. I have an advisory committee working at the ministry to give us support, and that is a broad cross-section of critical agents of society. So as it relates to the private sector, what we do is go to the umbrella bodies, we discuss a strategy, and we filter that strategy out. So yes, there was a run on a number of retail outlets.
Hoarding.
And hoarding. What has happened now since then is that retail outlets have now been restricting purchase of certain items to a certain amount. The truth of the matter is that it don't make sense. You have everything and nobody else has, because you become equally vulnerable. You may be able to sanitize, but if others
the other person has to as well.
So it doesn't make sense. So that kind of message has gone out, and I think with the help of retailers, the situation is improving.
And certainly, I also see on Twitter there are certain children's homes, senior citizen homes. If you are in a position, you have excess, whether it is sanitizers or hand soaps, bleach or disinfectants, we're just asking you to kindly donate some of those items, because as the minister says, it makes absolutely no sense if you are sanitized and you're sterile, but you are around persons who are without. So we ask you to also look out for those vulnerable communities, as well as persons who may be considered shut-ins. A question, a buzzword or buzzwords that we've heard around the coronavirus is social distancing. They're saying, hey, if you don't need to be in an overcrowded space, keep somebody a meter off, then please do so. We have some countries that are saying if you don't need to overcrowd the subways and public transportation, please don't. The question is, how do we, and it's coming from here, how can there be a directive to reduce overcrowding in buses and route taxis to enforce the maximum number of passengers to keep the COVID-19 at bay, especially when we're accustomed to the robot taxis, more persons in the minibuses, maximum capacity. How do we self-regulate or regulate those entities?
Well, social distancing is, in terms of the definition, it's not just in terms of being 1 meter or at least 3 feet away. It's actually several different things in terms of trying to minimize persons' risk and exposure. So in certain contexts, of course, you won't be able to have your 1 meter or your 3 feet. But for example, the hand washing, making sure you're washing your hands regularly, or using your hand sanitizer, for example, is a part of that process of ensuring that you are not overly exposing yourself and others, making sure that you're disinfecting common touch surfaces, which we often ignore. So we go into the bathroom, we pull the door handle, we wash our hands, the same hands that we just washed, we used to turn the tap off, and then we exit the bathroom pulling the same handle that we used to enter. And so those are some of the things that we need to be thinking of routinely. Similarly, for example, we have this penchant to be constantly touching our faces. So we're on the cell phone, swiping away.
Guilty as charged.
Swiping away on the phone, which is a common touch surface that we don't seek to disinfect either. And so these are some of the things in terms of processes of social distancing. So it's not just the space, the physical space between, although I do agree with you in terms of the taxis, etc. Certainly, if a cab is supposed to take 4 people plus the driver, we would encourage 4 people plus the driver and not 6, right? However, we do understand, but practice some of these other things as well that will help to mitigate. Another thing is in terms of if somebody is ill, do not send our ill children to school. If they're actively having a cough, a cold, a fever, that also helps to protect others. If you're going to work and you are ill, by not going to work, you are also mitigating as well. And so some of those things, allowing, for example, employers allowing persons, yes, they're not ill enough, but because it's a respiratory disease condition, you may decide you can work from home,
right,
and facilitating those things. So those are some of the measures that employers, individuals, even at home within the community, limiting the number of visitors you have. How are we greeting each other now? We are very social people,
Elbows.
as the PM has
Elbows.
said today,
Air
but
hugs.
now,
Air
we're doing the elbow wave, do a little bow. Some people are greeting each other with their feet now. I mean, we're coming up with different creative ways, but the point is that the hand touching and the hugging and those things that we're used to in terms of social context, we have to be mindful of now and ensure we practice.
Let me say that one of the advantages of if there is, I look for an opportunity in every challenge, and this is certainly a challenge, but one of the things that I think will come out of this is that it will put us back closer in touch with practicing good hygiene.
Good hygiene.
Can I tell you something? Personal experience. I never knew I touched my face so often until I started talking about touching a face and being told by others looking on that while you're saying it, you're actually touching it. And it's an involuntary action. But the conversation and repetition will become habit, and practice is telling all of us to adjust towards better hygiene. And I really think it's going to be a positive around coming out of this coronavirus threat. The downside, of course, is that part of our culture is that we're touchy-feely people. We love to hug, we love to greet, we love to carnival, we love to talk, right? Not every society is like that, but the Jamaican and indeed the Caribbean society is like that. And people are not offended generally when that takes place. So it tends to be difficult to now say, listen, keep your distance. But the reality is we have to do it in the interest of the overall health and wellness of the society at this point in time.
Right. The only thing that I'd like to know, if it is even possible, is the question by A.G. Hamilton Taylor is, does the government have any say, for example, in regulating how many persons? So, the taxes.
Well, right. That original question. No, what I would say is that to the extent that there is an assessment of risk, and as I was announced this evening, the suspension of certain events over the next few weeks at least, and where permits will not be granted or permits will be revoked, it is going to automatically, I think, restrict those gatherings and the need for maybe an overcrowded public transportation system. Society is all connected. I mean, to the extent that you may suspend classes, then you will suspend the need for that. Having said that, I do believe, and it's something we're looking at, the public transport system needs also a protocol. And there is the law, which requires certain numbers, as was said by Dr. Spence, but it's more observed in its breach than its observance, according to Shakespeare. So we may need to remind persons of what is the law, but also motivate and encourage based on the existing health threat. So putting up signs in the buses, for example, using the free Wi-Fi that's now available on JUTC to provide an uploaded page that automatically give you tips, and that sort of thing. Those are creative ways to try and get the message out there, which I know we're having a conversation around, yes.
All right. Given that numerous deaths happened to individuals within a nursing home, and that took place in the United States, are there special precautions being taken to limit visitation and contact with suspected sick workers?
Well, what we have said, there is a protocol which I think Dr. Spence can speak to as it relates to workplace. And we have been consulting with a number of work employers. Indeed, the meeting at the PSOJ, those questions came up. Things like, how do you treat with workers who are ill? The standard response, not just workers, but students or anybody, if you are sick, stay home. Don't go to work. Now, that raises some issues because the law prescribes, sick leave, what you're entitled to, what you're not, whether you'll get paid or not.
Correct.
And there's a conversation now that's taking place around that in light of this particular threat that we will have to address. But the standard response, we cannot afford persons who show symptoms, even before they get checked out, to transmit or transfer those symptoms to someone else. So stay home until you are better.
Absolutely. I think even when it comes to the cases of the coronavirus or any sort of health scare or health threat, institutions, employers, organizations, companies have to be flexible. I believe the Gleaner had uploaded something on Instagram today, stating, maybe not the Gleaner, but stating that Italy, I believe, has now put its mortgage payment plan on hold. Like there's an adjustment where they're understanding that there has to be some flexibility if the country and its citizens are under threat. So certainly we look forward to that. So what are the plans for lab staff? So, let's say that a lab is running low on PPE, lab coats, especially for large size people. Is there going to be a task force put in place or dispatched to all the laboratories to investigate the readiness of lab coats?
Well, PPEs in general include, the coveralls in terms of whether you term it lab coat, etc., the different masks, etc. So currently, in terms of the testing capacity in our country, that is in the National Influenza Center.
Okay.
Right? And so that is where testing for the virus will take place. In terms of handling of the samples that are taken, once they're taken, and usually the clinician is who is taking the sample, and say they would have on the appropriate personal protective equipment in order to take the sample in the first place. So the lab team is minimally handling the samples. What that means, therefore, is that they're packaging it for it to be transported. And so they should be observing their regular universal health precaution measures that are instituted in any lab in the first place in order to make sure that they are reducing their risk. Because any sample they take, again, because there are many infectious diseases out there that we are unaware of, there is universal health precautions and infection prevention control procedures that are standard that should be practiced. And so there is no additional personal protective equipment because the samples are not being tested at local laboratories, private and public, for example, within our facilities. It would just be packaging and transporting the samples to the center that is being tested at.
Okay, I'm going to bring in Dr. Gandhi. The Director General today from the WHO had said that in all of this, in all of the prevention, the containment, the contact tracing, everything that they're doing, that the countries are doing, we must ensure that we balance the protection of our citizens, that we minimize economic disruption, but most importantly, that we respect human rights. How important is it to respect human rights when you're trying to manage discipline, you're trying to manage possible infection and an increased rate of transmission without breaching, violating, encroaching on human rights? How important is that? And what are the things that we need to consider when respecting human rights in a situation like the coronavirus?
Well, I think it's important that the public understands what is going on, why we're taking the action that we are taking, and take responsibility as well to cooperate for the benefit of the entire population. I think also in terms of human rights, we have to be careful with stigma and discrimination, and that is critical. We cannot blame countries, we cannot blame persons coming from different countries, etc. We have to recognize we're all in this together. If it's China today, it's going to be another country tomorrow. We're all in this together, and we have to work together. And I think that the Director General has called for solidarity, that we maintain solidarity. Health has no boundaries, it has no politics, it has no allegiance. We have to work together if we have to control this epidemic so that we can all move forward.
Absolutely. I was just going to say that he did say solidarity is the key with people being on top of it. Masks. I'm now seeing a lot of Jamaicans wearing masks, and I've heard healthcare workers abroad as well as locally say, well, masks make no sense because they should be fitted. Some of them have space. So is it that if you are sick, you're to wear these masks? Is it that you wear these masks to prevent yourself from getting sick? The usage of masks, are we doing it right? Are we wearing it right? Are we wearing the right masks? Should we be wearing masks?
So the short answer to that question, and I'll elaborate a little bit, is to say that in general, the public, it is not recommended for the public in general to be wearing masks. It actually gives a false sense of security and actually opens you up to greater risk because we're not using it properly. and appropriately. It causes us to be, because it's not comfortable with constantly touching the face, and then we're not practicing the infection prevention and control processes either, because we're not washing our hands as regularly. We are not using the hand sanitizer that we're supposed to be using in between, because we feel that the mask is going to protect us. Masks should be reserved for the healthcare professionals.
Wow, okay.
Masks should be used by healthcare professionals also in specific situations as well. So say, for example, you have a patient coming into your facility who is actively coughing and sneezing. What we ask is for persons to hand them the mask, because you don't want to only protect yourself as the healthcare provider, but you want to protect others, because remember, it's through droplet and contact spread. Right? And so you offer the mask. When it is that we are conducting close contact procedures and assessment, then it's not just the mask that healthcare providers will have to put on. They have to put on their appropriate PPE, depending on what kind of procedure that it is, which the mask is a part of that, and specific type of mask. So the general public should not be wearing masks. Worst of all, at this juncture, we have 2 confirmed imported cases. The disease is not widespread. And so we don't want persons to have the sense that by having the mask, they're somehow...
False sense of security.
Exactly, protecting themselves, when in fact they're not. And I will recount an incident, recently seeing something where a person was wearing the mask and the mask was under the chin. And, and they were fiddling with the mask constantly. Defeating the purpose. And I just saw so many opportunities of where it is touching the face, touching the mask, and then touching other surfaces. So if it is that person were ill or had come into contact, you would have just spread or introduced the virus to other surfaces by having that mask in place.
It has been reported that China is now, I believe China and Korea, not too certain, but China for sure, they're seeing decreased numbers. We saw them spike, and now they're seeing decreased numbers, and we understand they're actively working to fight this virus. We do a lot of business with China. We have good relationships with them. So I guess the question is, are we getting information from China in regards to the work that they're doing in terms of fighting the virus? Because I don't believe the WHO has presented any of the work that China has been doing. So are we using our relations to find out, what are they doing? What are they doing right? What can we learn and implement here?
Yes. The WHO had a mission to China, 2 missions to China, to look and see what they've been doing, revisit the data, look at the research that they're doing. And they have been sharing that information and that experience with other countries. And this is why we are so convinced that in order to, that it's still possible in the region of the Americas in particular, that we can contain the virus. Because of course, we know that even in the region of the Americas, all of the cases are mostly imported cases, and the clusters around those cases. If we can contain and aggressively do contact tracing, as they have done in China, and this is where that evidence comes from, is by learning from the experience in China, and he said the numbers in China are going down. Similarly in Korea, the numbers are also decreasing as well now. And that is from the evidence of what is happening, and that evidence is what we are sharing with all the countries.
That's the data that we're sharing.
Yes.
We could talk about this all day. We have so many questions, but I know that we're running out of time, so I'm going to allow one last question. And that is our Jamaican diaspora. They come home, whether it is for vacation, sometimes it's for weddings, for funerals, they come home. For Jamaicans abroad seeking to return home, is there a required quarantine upon arrival or any consideration they should have? Should they just stay and wait it out? Like, what is your advice or your suggestion to Jamaicans who planning to come home or want to come home?
So for the countries that we have placed travel restrictions on, Jamaicans who return from those countries, and they've been in those countries within a 14-day period, would be required to be quarantined for that 14-day period. So they're either placed under house quarantine once the house is examined, and they can be placed in a safe space, or in one of our government institutions that we now have quarantine arrangements on. And we've done that for a number of persons. And that is just to be absolutely sure that they are not carrying the virus. And once that is the case, then they are released to go in the general public. We have, however, upgraded the concerns. Only this evening the Prime Minister spoke. And part of the recommendation to restrict travel to essential travel, in other words, avoid non-essential travel. And that is applied, by the way, to all the government services, to the cabinet, based on what the Prime Minister said. We say to Jamaicans, if you don't need to travel at this time, hold on. Clearly, if you have to, you have to. And Jamaica will always welcome its nationals. That's always the case. But if you come and you're coming from a country of concern, then we will have to quarantine you. If you don't need to travel, stay put for the time being.
Okay, I know I said that was the last question, but something just came in. There is now a case in St. Vincent. It's been confirmed, and that the person that has been tested positive is also stemming from the UK. I don't know if you have a comment on that. And Mr. Trump is banning all travel from Europe for 30 days as of Friday night. I don't know if you have any. I mean, you probably have not been briefed yet, but
so you know, it's expected. In fact, I saw just prior to coming on this program that there was a case today from Guyana.
Guyana, correct.
So you're talking now about Guyana, St. Martin, St. Bart's, Damrep.
Our neighbors.
So we're talking about 7 or 8 Caribbean countries. And as much as we don't want it, it's likely to get more because the virus is spreading. As it relates to travel restrictions, again, that is expected too, because countries are going to assess based on their own risk profile, and then they will balance the scales against the need to maintain travel or to restrict it. And that's what we have done. We're hoping that the situation will get better soon, and we will restore to normality in terms of these relationships. But frankly speaking, I anticipate that some of these things are going to happen in the coming weeks and months.
Thank you. Thank you so very much, Dr. the Honorable Christopher Tufton. Thank you, Dr. Simone Spencer. Thank you so very much, Dr. Bernadette Theodore-Gandi. Ladies and gentlemen, I mean, we don't want anyone to panic. We don't want you to have any fear. What we do want to encourage is facts over fear. And I think I take the opportunity to really commend the Ministry of Health and Wellness for the transparency. I know that you had tweeted out that there is a Dropbox with a link that you can actually go to get comprehensive updates about what is going on. Folders, I went into all the folders. This is legitimate, and I think the dialogue, the communication, the education will be extremely important going forward. We want to thank Flow very much. This was actually streamed from Flow's headquarters, and to actually do multiple streams at the same time, our bandwidth was actually powered by Flow. So to our friends at Flow, we say thank you very much for accommodating us at such short notice as well. Ladies and gentlemen, just please stay informed. Be quick. Don't be quick, I should say, to share, disseminate, or spread information that has not been confirmed. I would also suggest that you follow the minister at Chris Tufton. Sorry, sir, I never usually call you Chris because it's very informal. But at Chris Tufton, I've seen persons pose questions, and we encourage you to continue using the hashtag JACOVID19. I have seen him respond to those questions, as well as to the MOHWGOVJM. Follow them, stay informed. Antoinette Aiken, I cannot say thank you enough. Thank you so very much for representing and always educating the deaf community. We really do appreciate it. To the team, the staff, the healthcare workers, your frontliners, we thank you in advance for all the work that you have been doing and all the work that you continue to do. So, to the Market Me team, PR Communications, and the production team here at Phase 3, thank you so very much. Continue the conversation outside of this town hall meeting, and we will make sure that the Market Me team and staff go through those questions and answer them as quickly as possible. We wish you all the best. Please maintain good, proper hygiene. I am Terri Karelle. It was a pleasure being your moderator for this evening. Take care.
Very good.
Thank you. Thank you. Thank you.